This was the project we were involved with, Project 7. Tony Capon and myself were project leaders, and most of the work was done by Helen, Katrina and Barry, and I'll be handing over to them in a very short time. The objectives for the project was to develop an integrated view of urban systems and health in a changing climate, focusing on the various factors that have been discussed already today. And secondly, to improve the understanding of the dynamics of this urban climate health system and enhance the links between the subsystems. And the third one was to apply a systems dynamics understanding in the development of methods for the assessment of health impacts of and responses to climate change in the Australian urban environment. We use two tools for this process. One is health impact assessment and the other one is system thinking. So just to briefly mention health impact assessment, a lot of you are probably aware of it. It's normally a tool that's used to predict positive and negative health impacts of proposals, often project proposals, providing a holistic consideration of impacts and proposals, put concerns for equity and reduction of inequalities in health on planning and policy agendas, produce evidence-based recommendations and decision-making, and set performance indicators. And these are the normal steps associated with the health impact assessment process. We basically used this process in an investigation which we did some years ago now, which Liz mentioned, back in 2006. Screening, we decided we would try to use HIA to look at health impacts of climate change. We scoped that by looking at populations of vulnerable groups. We used the risk assessment process, which was fairly basic at the time, and this project, Helen in particular, has worked and developed a much more sophisticated risk assessment process for the impact of climate change on health, making conclusions and recommendations, and this is where the systems thinking comes in. And this is the publication that we developed as a result of using the HIA process, basically looking at the health impact of climate change in Western Australia, and this has subsequently been published in refereed journals. So I'll now hand over to Katrina initially, and then to Helen to cover the main parts of Project 7.